Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the oculomotor nerve. The oculomotor nerve is also called third cranial nerve. This is a motor nerve. The oculomotor nerve arises from the ventral surface of the midbrain. This is the midbrain. This is the beginning of the oculomotor nerve. It emerges from between the it emerges in the interpeduncular fossa between the basis pedunculi. Okay, so it is coming out here from the ventral aspect of the midbrain. It contains general somatic efferent and general visceral efferent fibers. It is a pure motor nerve. It has no sensory contribution. It moves the eyeball. Its name is oculomotor, so it moves the eyeball, and it it is important because it supplies a lot of muscles, extraocular muscles, as well as intraocular muscle. So it constricts the pupil because we'll get the innervation from the oculomotor nerve to the sphincter pupillae via the ciliary ganglion, and that is essential for constriction of the pupil. It accommodates because it works on the ciliary muscle that maintains the convexity level of the lens of the eye, and that will increase the refractive power of the lens, and it accommodates in that way. Okay, so that is done by the oculomotor nerve. It converges because the muscular actions as well as the action of the medial longitudinal fasciculus in accord with the fourth nerve and sixth nerve, the converge the two eye will converge to see a near subject or object. Okay, so oculomotor nerve has many functions. We'll go there. Okay, so we discussed that it is emerging on the anterior surface of the midbrain. We have seen that this is a section of the midbrain, okay, at the level of the superior colliculus and in the red nucleus. It passes forward between the posterior cerebral and superior cerebellar artery. Posterior cerebral artery are the branches of the basilar artery. Superior cerebellar artery is also branch of the basilar artery. So it traverses in the lateral wall of the cavernous sinus. Cavernous sinus is located at the side of the sphenoid bone in the middle cranial fossa. So oculomotor nerve is located in the lateral wall of the cavernous sinus. It enters the orbit through the superior orbital fissure. Usually it makes two branches, superior branch and inferior branch in the orbit. When it enters, by this time it is branched out, the superior division, inferior division. Okay, so it has a general somatic efferent component that arises from the oculomotor nucleus of the midbrain. Okay, so if we go to the previous image, we'll go to the midbrain. That is here is our okay. If we go there, so we have the oculomotor nucleus is located here. Main motor nucleus, oculomotor nucleus, and it is getting connection from multiple sources from the cerebral cortex here. From the cerebral cortex, it is getting connection from the superior colliculus, also from medial longitudinal fasciculus, that is contributed by the third nerve, fourth nerve, and sixth nerve. Okay, so it is also getting contralateral contribution from the cerebral cortex here. We are seeing that both ipsilateral and contralateral connection to the main motor nucleus of the oculomotor nerve. Okay, we have also in the midbrain area, we have the parasympathetic nucleus called Edinger-Westphal Nucleus, the oculomotor nerve that is associated with parasympathetic function, that by means of the short ciliary nerve from the ciliary ganglion, it would innervate the ciliary muscles and the sphincter pupillae muscle. That is the location of the parasympathetic nucleus, Edinger-Westphal nucleus, that is also connected to the pretectal nucleus. And these fibers, both the main motor nucleus, oculomotor nerve fiber from here, and also from the parasympathetic nucleus that passes through the red nucleus. This is the red nucleus. In between the basis pedunculi here, we have the cerebral peduncle, okay, and we have this is the crus cerebri here. This is the substantia nigra of the midbrain. It passes through the basis pedunculi, okay, going forward, and it goes to the cavernous sinus, the lateral wall of the cavernous sinus. It enters the orbit through the supraorbital fissure. Before its entry, it divides into upper division and lower division. Okay, we got that. So general somatic efferent component arises from the oculomotor nucleus of the midbrain. These nucleus are present in the periaqueductal gray matter. If you go there again, we'll go there. We'll find out that these are present in this is the cerebral aqueduct. This is the periaqueductal gray matter. Our nucleus is here. One is the main motor nucleus, another one is the parasympathetic nucleus or Edinger-Westphal nucleus. Okay, we got that. So from the main motor nucleus, we have the innervation of the following muscles: medial rectus, superior rectus, inferior oblique, levator palpebrae superioris muscle. This is very important, that elevates the eyelid. If this is paralyzed, then what will happen? We'll have ptosis. It is called complete ptosis. Okay, and these muscles are essential for rotation of the eyeball medial rectus, rotate the eyeball medially, superior rectus, rotate the eyeball upward, inferior rectus, it pull the eyeball downward, inferior oblique muscle, okay, that actually elevates the eyeball, okay, and it also move the eyeball, it also abduct and also extort the inferior oblique muscle, okay. General visceral efferent contains preganglionic parasympathetic fiber, arises from the Edinger-Westphal nucleus that is also present in the periaqueductal gray matter behind the main nucleus of the oculomotor nerve, behind the main motor nucleus of the oculomotor nerve, projects to ciliary ganglion via the cranial nerve number 3. This is the oculomotor nerve from this nucleus. Ciliary ganglion provide postganglionic parasympathetic fiber to the sphincter pupillae muscle that is present in the iris of the eye, that controls the diameter of the pupil. There is a gap in the iris along with the dilator pupillae that is innervated by sympathetic nerve. Will not go there. Our target is the sphincter pupillae, that is the parasympathetic. It is innervated by the parasympathetic nucleus via ciliary ganglion through the short ciliary nerve. Okay, it is essential for meiosis, that is for the constriction of the pupil, and also it innervates the ciliary muscle, that is essential to increase the thickness or the diameter. It increases the thickness or convexity of the lens, okay, for proper refractive function, okay. So clinical correlation of the oculomotor nerve is very important to us. Oculomotor nerve may be paralyzed, caused by transtentorial herniation, may be caused by a tumor, okay. Aneurysm, that is the abnormal dilatation of the blood vessel, may be the posterior cerebral artery or the superior cerebellar artery, okay. Aneurysm, or maybe aneurysm in the internal carotid artery in the cavernous sinus, that may also compress the third nerve, and that may compress not only third nerve, all other nerves in the lateral wall of the cavernous sinus, like that of the fourth cranial nerve, and also will get the trigeminal nerve, two division, the ophthalmic division and the maxillary division, and also the sixth nerve, that all may be compromised by any region of the internal carotid artery in the cavernous sinus. In case of diabetes mellitus, central fibers may be affected. The pupillary fibers may be partially affected in diabetes mellitus. Okay. Cranial nerve 3 paralysis is characterized by diplopia of vision. Again, we have to know that these are diplopia because two eyeballs may not move together because of the paralysis of the extraocular muscle. Okay, ptosis, that is the drooping of the eyelid droop down. Okay, and when we examine the eye, the eyeball move down and out because of the unopposed action of the superior oblique, which is innervated by the fourth cranial nerve, and lateral rectus, which is innervated by the abducens nerve. They will be dilated and fixed pupil. That may happen because sphincter pupillae is not working, because the third nerve is not carrying the fiber from the Edinger-Westphal nucleus. In certain situations, paralysis by accommodation, we call it cycloplegia. Cycloplegia. Okay, Plegia. Cycloplegia. So, and that's all about the cranial nerve number 3, oculomotor nerve. If you like my video, please support my channel. Please subscribe me. Share the information with your friends. And if you have any question, please feel free to ask me. And have a nice day. Bye now.